Good afternoon, everyone. It's 2 o'clock, time for our 2 at Tuesday update. And I am pleased to be joined by Dr. Gale Burstein, who you'll hear from very soon, as well as Kendra Schmidt from Deaf Access Services, who will be providing the American Sign Language. We have a lot to go over. This is actually probably the most comprehensive report we're going to have in some time. Lots of information on vaccine as well as COVID-19 cases and some trends we're seeing in the community. So let's get right to it. Oops, I seem to have hit the wrong thing here. There we go. Total cases through March 7th, 66,452. We have seen the 7-day positivity rate kind of level off. It's now at 3.5%. We've had some days in the 2s, and then we've had some other days in the high 3s. So the positivity rate has dropped as it was a month ago, but it's pretty much leveled off as it was the last few weeks. Hospitalizations continue to drop. 146 patients were in hospitals across Western New York with COVID-19, 32 of them in the ICU. 121 patients were in Erie County hospitals, 27 of them were in the ICU, 19 on an airway assist. Unfortunately, 2 died on March 7th, and 42% of patients were under the age of 64 and under, I should say. So we have seen a drop in hospitalizations. That's a good thing, and we want that to continue, and the best way for that to continue is to see the cases continue to drop. So if you're looking at the case rate, you will see for the last 6 weeks, the end of December, we were at a positivity rate of 5.2%. We are now down to 3.5. It's not really much of a change from the prior week, which was 3.6. We once again have seen a drop in the number of tests that were performed, and we have seen a drop in confirmed cases, but the positivity rate really hasn't changed that much. So basically 3.5% of all tests that we're doing are coming back positive, which does prove that there are COVID-19 cases, new ones in our community. And just as an example of that, there were 1,608 new confirmed cases. These are not repeats. These are new confirmed cases of COVID-19 for Erie County in the week ending March 6th. So there are still people getting sick with COVID-19. And as I talked about last week, there are people who haven't even gotten sick yet who will get sick and unfortunately probably die from COVID-19. That's why we need to continue to do our best to protect everyone in our community. The zip codes numbers, I'm very disappointed to see that my hometown of Lackawanna is still number 1, and it actually went up by percentage. It was 6.8%, I believe, last week. It's 7.0, so I don't know what you're doing in Lackawanna, but you guys have to, and men and women have to do a better job of protecting yourselves. If you're partying, things like that, please be careful because COVID-19 is still in our community, and Lackawanna had the highest rate as it pertains to not only the percent positive, basically double what we are for average for the county, but also the highest on a 7-day average for an average of 100,000 population. We still have new cases that are across our community in urban, suburban, and rural settings, but it's disappointing to see that in my hometown of Lackawanna, for whatever reason, it is not being taken as seriously as other places, and that is bad because people are catching it and getting sick. Hospitalization data, we talked a little bit about this already, but you can see the trend line for the last 2 weeks. Overall hospitalizations going down, slight declination in hospitalizations associated with ICU patients, as well as those that are on airway assist, and we have continued to see deaths in Erie County. We did have 1 day in the last week where there were no deaths in a hospital as a result of COVID-19, but we're still seeing individuals dying as a result of COVID-19, and as always, we offer our deepest condolences to the family and loved ones of those we've lost from this terrible disease. And looking at the numbers, there are now 10 individuals who died in Erie County in the month of March alone from COVID-19, and that is through March 4th. So that's more than 2 a day on average. And February, we're still cleaning up the numbers, but at this point there were 133 individuals who unfortunately died of COVID-19 in the month of February in Erie County. And it just goes to show that COVID-19 is still out there. People are getting sick, and unfortunately people are dying. 1,677 people have died from COVID-19 in Erie County, and we still have not hit the 1-year anniversary of our first case. We actually had 3 cases that we announced on March 15th of 2020. So we still don't know the full extent of how many people have died in 1 year in Erie County from COVID-19, but the number is not good. So we are saddened to see that people are still passing from COVID-19, and they're not all seniors in nursing homes or non-ambulatory. Some of these individuals are people we know in our community. I want to talk a little bit about vaccinations and where we are with regards to percentages for the entire county. So 19.8% of all Erie County residents have received a first dose, but we want to note that children 17 and under cannot get the vaccine. And there are roughly 180,000 individuals in Erie County that are under the age of 18. So when you take a look at the numbers and do the percentages, roughly 24.2% of all adults in Erie County, not just those who qualify, all adults have received a first dose of the vaccine. And 9.6% of all residents have received a second dose. They've completed their dosage, and that's 13.5% of all adults. We are just starting to do the first doses of Johnson & Johnson, the Janssen-based that is owned by Johnson & Johnson this week. So we expect to see that second dose actually be the full dosage number increase. But it just goes to show that after everything that's gone on with regards to vaccine delivery and how we are not happy, we wish it was faster, and it's getting better, and we'll talk a little bit about that in a second, that still nearly 25%, or 1 in 4 adults in Erie County, have received the first dose of vaccine at all the sites in Erie County, and if they've gone elsewhere. The Erie County Department of Health has administered 30,782 first dose shots, 20,404 second dose shots, and we'll be administering a couple hundred Johnson & Johnson shots today alone, which are single dose shots. So we are ramping up our numbers. It's good to see, and I think that's also a reason why we are seeing a declination in overall cases as it pertains to COVID-19. The more people we vaccinate, the less people that are at risk for catching it and getting very sick. Now, vaccine allocation, this is important. We've been advised by the New York State Department of Health we'll be receiving 3,710 vaccine doses from New York State for the upcoming week. That is a drop from the more than 7,000 we had last week, but there's a little proviso there. 1,670 of these doses have been determined by New York State. They have to go to essential workers. So those will be the pool of individuals, including teachers, those who work in schools, those that are part of the 1B category listed as essential workers. We feel really good about where we are as it pertains to fire, police, and our NFTA transit workers. We think we've done a very good job working with our partners to vaccinate all those individuals. There may be some people out there still who need it, but the vast majority of them have been vaccinated. So 1,670 doses will be reserved for those associated with the remainder of the essential workers. Comorbidities and those that are the OPWDD, or the New York State Department that deals with those who have developmental disabilities, combined 1,840 doses. So those will go to those that have comorbidities or in the OPWDD pool. And we feel we've done a very good job also of finishing the congregate care settings for OPWDD individuals. So we feel like most of these group homes that you often know about have been taken care of, so that's a good thing. And then we have 200 Janssen, which is the Johnson & Johnson drug, doses that will be allocated in the upcoming week. We've requested another 1,000. We're hoping to receive those, but the adults age 65 plus, we haven't received a separate allocation for. At least notice that we're getting it. We've requested 3,510 doses from the New York State Department of Health for the 65 plus category. Just like last week, they gave us an additional amount for the 65 plus category, and we're vaccinating those people right now. We are hopeful that we'll get the additional 3,510 doses we requested. If not, we're only getting 3,710. A little disappointing to see that, but we're continuing to work the phones, and I'm hoping that in the next 24 to 48 hours we'll get notice that we actually will be getting another 3,500 doses specifically for the 65 plus category. Now, Erie County has multiple vaccine sites. We have multi-day clinics that have been in place for some time now and will continue at SUNY Erie North, SUNY Erie South, and of course opening tomorrow will be the KeyBank Center. But we're also opening up one-day pop-up clinics across the county. to serve seniors in their communities. So today, the Erie County Department of Health is running a first dose clinic at the Hamburg Senior Center, in which it is fully booked, and hundreds of seniors will be getting their first dose of vaccine there today. I believe it's the Pfizer vaccine. Thursday, we have a clinic scheduled at the Concord Senior Center, so just outside there in the village of Springville, but the Concord Senior Center will be down at the southern tip of Erie County. Really can't get much south of that unless you're going into Cattaraugus County. So Thursday, we have a pop-up clinic scheduled for there. Next week, we have a pop-up clinic scheduled for the town of Cheektowaga Senior Center. These are one-day clinics. We are utilizing the list of individuals who requested to be put on our waiting list, our notification list, to inform individuals of these pop-up clinics. So if you're searching for these clinics on the New York State site, you're not going to find it, because we've been authorized to basically reduce the population that is on our waiting list, utilizing those who applied previously that are 65 plus. All these locations are by appointment only. If you do not have an appointment and you walk in, whether it's the multi-day clinics at SUNY Erie sites, the Key Bank Center, or the pop-up clinics, you will not be able to just walk in and get your dose. We're not in a situation to be able to do that yet, though I'm hopeful, because of the passage of the American Rescue Plan, that that is something we will be able to do very soon as more clinics are opened. So if you want to be included on the notification list, and there's thousands of people already on there, but if you want to be included on the notification list, you can go to the website, www.erie.gov/vaccine notice. Fill out the form, fill out your category. You will be included in the list as we move down these lists. And we are doing, as we said, we're going to do over 3,000 seniors this week. We had approximately 17,000 seniors on the waiting list, but we feel if we get a substantial amount of doses in the next few weeks, we'll be able to clear out these waiting lists, if not by the end of March, at least early April. So that's a good thing. So if you want to receive notification, please sign up at Vaccine Notice, erie.gov/vaccine notice. And with that, I'm going to turn over to Dr. Burstein, who's going to talk about the eligibility, which has changed. Governor Cuomo announced earlier today, and the biggest thing we want people to know is eligibility does not mean availability. Kendra can take a rest.
Thank you. So, as the county executive mentioned, the vaccine eligibility does not mean vaccine availability. As Mark mentioned, we're getting less vaccine this week than we did last week. So, the vaccine supply is still tight. We're trying as hard as we can to get it out to the people that need it most, that are the most vulnerable, that could become very ill, or who are very likely to get exposed. But it's going to take some time. So the good news is that the governor has expanded vaccine eligibility, so there'll be more people who will be able to get vaccinated when we do have more doses. So starting on March 10th, all adults ages 60 plus will be eligible to get vaccinated, so that's moving from 65 plus to 60 plus. Also, starting next week, every vaccine site will be open to every single category of eligible New York State residents. So in the past, we had restrictions that we could only run pods for vaccine clinics for 65 and up, or for essential workers, or for healthcare providers. And now, all the vaccine sites will be able to offer vaccines for anybody who is eligible. So we won't have to stay in any lane, and it'll be so much easier for people to make an appointment and get that vaccine. The caveat is that for pharmacies, they still can only vaccinate people who are 60 and up and school staff. So starting on March 17th, the eligibility will expand even further, that we will be able to vaccinate public-facing employees of nonprofits, public employees, essential workers, and building workers. So remember, these are public-facing workers. So if somebody's working in the back, in accounting, that's not a public-facing worker. So these are the people that are out there getting exposed, doing the hard work that we need done, and we want to protect them. So we're really excited that we're going to be able to offer those individuals vaccine. So this is looking at the vaccine distribution by zip code in Erie County. So this is looking at the proportion of people in each zip code that have received at least one dose as of March 6th. So just let me walk you through this. It's a little bit busy. So the yellow rows correspond to rural areas. The green rows correspond to suburban areas, and the blue rows correspond to urban areas. And so you can see that the disparity is not is also based on where people live, but it's really, we feel that it's more based on income. So we see that people living in poor areas, whether they be in the city or in rural areas, are more likely not to be immunized compared to people who live in areas that are wealthier. And also people that live in areas that have easier access to vaccine, where more vaccines like clinics are located. They're also doing a little bit of better job of getting vaccinated. So we are looking at these data, and I think New York State is looking at these data. And in these areas where we're seeing low numbers, we're doing outreach to make sure that people are educated and they're going to want to get the vaccine. And then also we want to make sure that accessibility is not a problem, that they'll have a vaccine clinic near them that they can easily get to, and so they can get vaccinated. So we are looking at these data. So CDC has offered some guidelines for people that are fully vaccinated, so we get a few perks, a few get-out-of-jail cards. People that are fully vaccinated, they can actually gather indoors without a mask with other people that are fully vaccinated. So if you have friends that are, if you're fully vaccinated and your friends are fully vaccinated, you can actually get together and have a dinner party or watch a Sabres game together. If you are fully vaccinated, and you don't have to wear a mask in that instance, so no mask in that instance. Also, if you're fully vaccinated and you want to get together with people who are not fully vaccinated, you do not have to wear a mask if these people are members of a single household. So if you have multiple households in your home and you're vaccinated, and two or more of the household members, different households are not vaccinated, then everybody has to wear a mask. But if you're vaccinated and you only have members of one other household that are not vaccinated, then you do not have to wear a mask. Unless there are people that are in the group that could become severely ill with COVID-19, then we really want to make sure everybody's protected. Also, if you've been exposed to somebody with COVID-19, you do not have to go into quarantine and get tested if you've been fully vaccinated, except if you live in a group setting. If you live in a congregate setting, then we want you to stay away from those other individuals in the congregate setting, just to make sure that we don't spread disease in a congregate setting. So the New York Forward guidelines are also expanding, so we can engage in more social activities that we've really missed. So restaurants, starting March 19th, are going to be open at 75% capacity. Also, as you know, later this month, weddings and large catered gatherings will able to take place. And the Erie County Health Department, we want to work with these venues and the people holding these gatherings to make sure that they're not only fun, and they're safe. So at least 5 days before the event is scheduled, we would like a plan, and you can submit that plan to our Erie County Health Department website at erie.gov/health/event notices. When our sanitarians will review the plan, make sure that everything is ordered and you have what you need to have a safe and fun event. Also, there have been a lot of changes in New York Forward and a lot of changes in the quarantine guidelines and what people can do if they're vaccinated and if they have to wear a mask or not. So we have all that information on our Erie County Health Department website at erie.gov/health. And then we have a COVID-19 website that you can go to that has all that information. So now I'm going to talk about what our guidance is for people who are vaccinated and who are exposed to a COVID-19 case and otherwise would have had to go into quarantine. So people who are fully vaccinated or people who've been infected with COVID-19, both in the past 90 days, you have a get out of jail card. You do not have to quarantine if you're exposed to somebody with COVID-19 for up to 90 days since your infection or since your last dose of COVID-19 vaccine. So we feel that we have this window of 90 days, and this is evidence-based. We have good data to show there is good immune protection, either from a natural infection or from the vaccines for 90 days, that you will not get sick if you are exposed to COVID-19. You may get infected. We're hoping that's not true. However, if you do get infected, you will not develop any significant illness. So in that case, if you remain asymptomatic, then you do not need to quarantine in those circumstances. So the guidelines are always changing. We're actually hoping that they're going to extend that 90 days out a little bit. So keep tuning in to our updates, and we'll make sure that you are fully up to date. And we also have all this information on our website. Also, just want to remind people that even though that we're seeing lower numbers of COVID-19, people are still getting infected. We still do have cases in Erie County. The numbers are going down, and we do still have cases. And our kids are not getting vaccinated, so not everybody is protected. So it's important that if you develop symptoms, or if you haven't been vaccinated and you haven't been infected and you have been in contact to somebody with COVID-19, that you know your status. So we recommend that you get a test somewhere. There are many places in Erie County where you can get a test, and you can find that test website on our Erie County website. If you want to call the Erie County Health Department at 858-2929, we can schedule a free test for you. These tests are available to all Erie County residents, regardless of the reason that you want to get tested. We are doing PCR or molecular diagnostic tests. And those results are available in 1 to 3 business days. It's usually after 1 to 2 days. It usually doesn't go 3 days, so we're getting a pretty fast turnaround time. And then we're also offering the point-of-care test or the rapid testing, where, of course, you get the results before you leave the site. It's usually within 30 minutes, so know your status. Just want to give you a couple updates on youth sports. So we've been monitoring cases among youth sports teams, and so far there have, since we started monitoring this on February 1st, we have put 83 teams on pause. So if somebody on the team is infected, in addition to the case investigation and quarantining close contacts, especially because we saw what happened with the Sabres when they played the Blue Devils, we just want everybody to take a pause so nobody gets exposed by somebody who is undiagnosed and doesn't have symptoms, and we don't continue to spread disease. So we're putting teams on pause if somebody on the team does have a case, just for 10 days. Right now, there are 9 teams that are currently on pause, and these are a variety of teams, so of youth sports. So there's hockey, basketball, baseball, softball. There's been bowling. So there is no safe that is completely immune. Just want to remind people that there are things that you can do to decrease your risk of getting infected with COVID-19 when you're participating in these sports. It's really important that kids participate and get healthy, and there are things that we can do to stay healthy while you're participating. So we know that there's transmission in the locker rooms, so if you can, if at all possible, please do not go in the locker room. Limit the locker room. Change outside, change in your car, do whatever you can, but please try not to go into the locker room. Avoid that. Also, if many teams have celebrations and they might travel or they might have parties, but again, please, our youth are not vaccinated yet, so we really want to limit the travel, especially outside of New York State and outside of Western New York and outside the Finger Lakes, and also we really want to limit team social events because we have seen transmission in these social events. Also, everybody's got to monitor really closely for symptoms because if somebody has symptoms, they could have COVID-19, and we don't want to transmit it through to other players on the team or to other teams. And then also, don't play when you're sick. Just remember, want everybody stay well. Just like going to school, everybody's going to stay well. So speaking of schools, these are looking at the number of cases that among students and staff in our K through 12 schools that since we've been monitoring in the beginning of the fall. So I just want to point out that, first of all, look in the past couple weeks, we've still seeing high numbers in the schools. Our numbers now are as high as they were in, earlier in the fall and the latter part of the winter. So we are still seeing cases in schools. We're doing everything we can to limit transmission in the classroom. However, there are still cases in the schools. And then just also to point out that even though teachers are able to get vaccinated, we're still seeing a higher proportion of school staff and teachers that are infected compared to the proportion of staff in the school. So, staff, please, think about staying safe, limiting in-person meetings, don't hang out together in the break room. That's where we're seeing transmission. We have been working with one school recently that has had an outbreak in the school. The St. Benedict School in Amherst, New York, has had 9 cases in 3 different classrooms in a very short time period. So we're considering this an outbreak in the entire school because it's affecting more than one classroom. We've recommended to the school on a couple different occasions, on March 5th and March 8th, that the school take a 10-day pause from in-person learning and go to complete virtual learning. The schools decided not to do that. So we just want to alert Erie County residents, especially families that send kids to the school. So you want to make sure that you monitor for symptoms, and if anybody does develop symptoms, please get tested. And that's not only for the students, because students can have asymptomatic infections, but also for the family members of the students and the staff. So we just want to alert Erie County residents that this could be a problem, and we just don't want it to grow even more. And we're making sure that everybody is aware. If you want to get tested again from the Erie County Health Department, call 858-2929, and you can schedule a PCR test to know your status. So there have been a lot of changes with youth sports, with the rules and regulations, and with tournament rules and regulations and what is permitted. So we want everybody to be informed. So we're going to be holding a webinar for youth sport coaches and staff on March 16th at 6:30 p.m. So we are going to review the recommended safety measures for tournaments. We're going to review the facility requirements and tournament requirements, what we do for case investigation and contact tracing and isolation and quarantine, and then answer all your questions and also to provide some resources. So if you want to participate in the webinar, which will be a lot of great information, so if you're planning on participating in a tournament, and you're a coach or work with a team, please call 716-858-7690, and we will send you a link so you can log in to that webinar. And I am going to turn it over to the county executive and take a breath, and he will entertain questions. So thank you.
We have to make a slight change because there's actually an addition. So we're just putting in a new presentation at this point to include information on the American Rescue Plan. But I did want to note we have some individuals in our community who are saying we should just open schools up totally. We are following the CDC standard, the New York State Department of Health standard, and it's New York State and the New York State Education Department that makes determinations as to what the standard is going to be in schools. It's right now 6 feet break, and as was just noted by Dr. Burstein, there is an issue such to the point that our Erie County Department of Health recommended the St. Benedict School in Amherst that they should shut down all in-person activity for 10 days. They have elected not to do that. So we felt it was important that we let the parents, the teachers, the other school staff who may not know about the cases at St. Benedict's to know what is going on so that they can make an informed decision as to whether or not they send their children, or for that matter, the employees report if they feel that they're at risk. It's very important that we get this information out to the public. Earlier this year, we had an issue at St. Francis, and they agreed they would shut down for 10 days, and we believe that stemmed the tide in that school, such that the number of cases reported from St. Francis dropped after the pause period was put in place. And we thank the St. Francis family for doing that. We would hope the St. Benedict's family would do the same thing. I want to talk a little bit about the American Rescue Plan and the impact it will have in Erie County. Of course, it was originally passed by the House. There were some minor modifications, but passed on the number, 50 votes, by the Senate over the weekend, or this past few days, and Senator Schumer was in town this week talking about the impact that we will have. Erie County will receive $178 million over what is a 4-year period, though. It's going to be split in 2 different payments, split in half. The city of Buffalo will receive $350 million, once again, to be used over a 4-year period to cover shortfalls and other related expenditures. And then towns, cities, and villages will receive millions as well. Our schools will receive aid. And as Senator noted today, the goal is to get every school back open with every student in the classroom no later than September. So for the next school year, everyone would be back in. And we hope by the end of this school year, everyone would be, though we know that probably isn't going to be the case, at least in all districts. And there's funding for childcare and to help New York families. There will be direct aid to municipality. It can't be just spent on anything. I know people are like, oh, you guys are going to go on a crazy spending spree. Well, it can't. Costs, of course, associated with responding to COVID-19, the public health emergency, as well as negative economic impacts. So we lost substantial revenue like others did when sales taxes went down. We can use that to offset the revenue losses caused by the COVID-19 emergency. And we can do necessary investments in areas addressing health and wellness. So we're going to create, I shouldn't say create, we're going to invest in the Live Well Erie plan like we had planned, but we had to cut because we want to increase people's long-term life expectancy. We want to be able to reduce poverty in our community. So we're going to be able to invest in the Live Well Erie plan. We're also going to invest in ErieNet. The plan allows us to invest in water, sewer, and other sewer broadband infrastructure. So it is our intention to move ahead with the ErieNet plan to put a 360-mile plus high-speed broadband middle mile network across Erie County into every community, so there'll be no more excuses that it's too difficult for these final mile providers to put fiber right to a house or a business. It won't be after we implement ErieNet, and we are going to be able to pay for all of ErieNet using assistance from the American Rescue Plan. Because as we've learned, if you don't have high-speed internet, if you don't have high-speed broadband, when we shut down basically the community, you're left behind. Families were left behind. They had difficulty having their children attend virtual sessions. We need that high-speed broadband, and we're going to get it now with ErieNet. We're going to invest to address the social determinants of health with the Live Well Erie plan so that we can address the health inequities that exist in our community. We can do that under the American Rescue Plan. The American Rescue Plan is not just for governments. Of course, there's going to be assistance, an extension of the PPP program for small businesses, assistance for restaurants that have been put at risk. They're going to be able to get what's basically a 6-month grant, not a loan, a grant from the federal government. And then individuals are receiving a substantial amount of assistance. If you are an individual, you earn up to $75,000 or a couple up to $150,000, you will receive a full direct payment coming very soon from the federal government of $1,400 per person. So if you're a couple, you make $120,000 combined, you're going to get $2,800 from the federal government to help stimulate the economy and pay for your expenses. If you're late on rent, you can pay for rent now. If you have dependents that you declare on your tax return, you will get an additional $1,400 payment for each dependent. So for some families, this is going to be a substantial amount of money that they can use to pay for their expenses, to pay for child care, to help them if they're behind in their mortgage, to assist them in stimulating our economy. If you are unemployed, federal unemployment benefits will remain at the $300 per week, but will be extended through September 6th. So if you're currently receiving federal unemployment benefits that would have run out, it's going to be extended until September 6th. And the first $10,200 of unemployment benefits for households with incomes under $150,000 will not be taxable. And it is taxable, but it will not be taxable. So if you've received unemployment benefits, you don't have to worry about paying personal income tax and the federal government on that. if it's under $10,000. There's going to be assistance in growth in the child tax credit, increasing the amount to from $3,000 to $3,000 for ages 6 to 17 and $3,600 for children under 6. And there's a gradually reduced amount depending on how much you make. But this child tax credit is really going to help individuals, especially those that are in poverty. And families eligible for the full credit will get payments of up to $300 per child per month from July to the end of the year, which is going to be a huge difference to families that are at risk of losing everything. Families that are on the edge. They're often called ALICE, asset limited income constrained, which means they're barely making it. They're going paycheck to paycheck. And these families are very close to being in poverty. Well, the federal government is coming because at a time of need, you need the federal government to step up to the plate. And they need to swing for the fences. And they need to hit the ball. And they got to hit it over the fence. And that's what they did with the American Rescue Plan. They hit a grand slam for the people of America, for the businesses of America, for those in government so that we can provide services that are so desperately needed without having to raise property taxes. And we are not allowed to raise property taxes just because we got the American Rescue Plan funds. So there's guardrails in place to ensure that we're not raising property taxes to bring back these jobs, but we're paying for it with the federal assistance. Senator Schumer was in town today. He is the majority leader of the U.S. Senate, and he got this deal done. President Biden specifically noted how difficult this was, but Senator Schumer got it done. This bill would not have passed without the great support of our senior senator, Senator Chuck Schumer. I had the privilege to join him here today at Manna's Restaurant in Buffalo as we talked about the American Rescue Plan, the impact it would have for restaurants and other individuals. Restaurants, as we noted, will be getting assistance. He knew it was important to help our restaurant industry, our hospitality industry, and they will be getting assistance. So on behalf of the people of Erie County, and for that matter, my county colleagues across Western New York, I want to thank Senator Schumer once again for his strong advocacy, his dogged determination to get the American Rescue Plan done. It wasn't easy, but as a result, not only are we going to be able to address the COVID-19 pandemic and ensure that every American is vaccinated who wants to be vaccinated in a very short period of time, but we're going to be able to address the economic distress that was caused by COVID-19, the worst economic conditions that our country has seen since the Great Depression. We still haven't recovered from it, and the assistance that was provided by the federal government to local governments will give us the money we need to ensure that we're not only being able to return people to work that unfortunately had to be laid off, but we can invest in the programs that will make a difference in our community. So thank you, Senator Schumer. And with that, we will open it up to questions. Just a reminder, please hit *6 to unmute your phones. Decide. To make a change, the CDC makes a change, well then of course we'd make a change. But as was noted, we are still seeing cases in schools. We've seen an uptick. There were more cases in schools this past week than there were in the prior 2 weeks. So while the numbers are going down countywide, we are seeing an increase in school-related cases, and we have the cases over at St. Benedict schools. That has resulted in Erie County Department of Health recommending that they actually go to virtual learning for the next 10 days. There are some out there who are saying schools are safe, you can't catch COVID in schools. That is absolutely false. We know that to be false. And anybody who's out there saying schools are completely safe, is putting individuals at risk. We're talking about students, we're talking about teachers, we're talking about the staff that works otherwise at school. Schools, and so we will follow the CDC and state protocols until such time as they're changed. If not,
No, Mark doesn't. Pharmacies are getting COVID vaccinations now. Do you have any idea how many there are and what this does to your figures on how many people have gotten one shot, whatever? I mean, like the Seneca Nation. Pharmacies are getting COVID vaccinations now. Do you have any idea how many there are and what this does to your figures on how many people have gotten one shot, whatever? I mean, like the Seneca Nation.
But there sometimes are changes, like we have to do it for a particular community.